There we go. Okay, does that look okay? I'm assuming so. Good afternoon, good morning, good evening, wherever you are. Thank you for the invitation to be here today, and it's great hearing from the other speakers, highlighting and reinforcing some of these issues that I think we are all becoming very familiar with through this latest IPCC report and through many of the conversations that we are having and have been having for the past several years. So my name is Jonathan Sury. I'm a project director at the National Center for Disaster Preparedness. I'm going to talk to you a little bit about climate, gender, and compounding crises through my experience and my lens of working primarily domestically, but also in the field of humanitarian response and recovery. Just NCDP, we are an academic-based research center at Columbia University, at the Earth Institute, which is now the Columbia Climate School. We try and focus all of our work on research, policy, and practice, providing evidence base to inform policy and public health practitioners and emergency managers around the world. We have done a lot of work around long-term disaster recovery, primarily starting during Hurricane Katrina, 2005, and moving forward through Superstorm Sandy and the Deepwater Horizon oil spill as a technological disaster. And much of our work has also been focused on the specific needs of various vulnerable populations, in particular children. We have a project called the RC Initiative that may be of interest, that's developing a model of child-focused community resilience and preparedness. And I'll touch on that a little bit today, but happy to speak about that a little bit more later. So I created this slide, I think around 2014 during the Ebola crisis or just beforehand, to kind of highlight some of the trends that we were starting to see emerge: extreme weather events, the corresponding emerging infectious diseases that were starting to pop up, and people like Dr. Steffen Morse have been raising awareness about for quite a long time because of our lack of overall preparedness and planning to adequately address some of these biothreats. The increasing frequency and severity of technological and man-made disasters, of NATEC disasters that are becoming more and more common and that are not doing us any favors on top of these already pre-existing issues of exacerbation of disasters by climate change. And at the same time, we're also individually, collectively, as organizations and as nation states dealing with an information overload and grappling with almost too much information and not enough information at the same time. And so we're constantly trying to sift out and find good quality data and good information. And luckily, the science for the attribution due to climate change is getting stronger and stronger, and that helps, but communicating that to the general public and making sure that everybody understands it and is literate in it, but also knows how that translates into individual action is something that requires a little bit more attention. In the disaster management life cycle, we have preparedness, response, and recovery. Typically, they're viewed as a cyclical response, but ideally, we are always preparing for and always mitigating for disasters. But typically, we've planned for one disaster at a time or one type of disaster at a time. And I think COVID-19 in particular has raised a new level of awareness of the complexity of these cascading and compounding hazards and disasters, further exacerbated by climate change. And so now we're not just planning for one event, we're planning for two types of events. And so there was a lot of very rapid changes in disaster planning and policies that had to happen on the fly that should have ideally happened beforehand as a result of COVID-19, particularly around emergency sheltering and any kind of congregate facility where people are going to be together in the event of a displacement during a disaster. So it's kind of turning the planning paradigm on its head a little bit, and it requires a new way of thinking about some of these problems. As we've already heard today, the exacerbation of many of these issues due to climate change is becoming clearer and clearer. And in particular, there are many types of disasters and many types of climatic events that we're going to be seeing more of and more severity in. And this is a graph from one of the IPCC reports just showing the confidence that there will be an increase in certain events is overwhelming in some cases for extreme heat, for mean precipitation, average precipitation and flooding, heavy precipitation, atmospheric CO2 and sea level rise and coastal flooding, and many of the issues that we've already touched upon today. But all of these have human impacts. They don't just occur on their own. There's a direct intersection with the livelihoods and well-beings of individuals, households, and families. And so post-disaster, vulnerability is increased in a variety of different ways. You know, we lose control over natural resources, including water. We lose access to and control over production of resources, to information and decision-making. There is increased energy, both individually and organizationally, to develop new strategies and also find new ways to generate income, especially in an event of displacement. There's a shortage of basic services. There's a service gap that ends up happening where your demand for services overwhelms your capacity to provide those services. That can be due to workforce shortages, people being sick themselves or being worried about being sick. And so the shortage of basic services can hit the education sector, the healthcare sector, and general employment, as we saw during COVID-19. There's a added stress and reduced ability to support children in general, but also in their education, as we also saw during COVID-19, and ability to difficulty in being able to provide sustainable income as well in the short term, immediately after disaster, as various aid systems are either in place or not in place, or are functional or not functional. And of course, the natural disaster itself creates vulnerability. So bringing this around to gender and vulnerability and a term called intersectionality, where we have an overlapping of different types of risk together that has an individual level effect on how somebody accesses services and resources and has power within a system. So looking at gender in itself and intersection with social, economic, and commercial determinants. So this is the effects that gender has in addition to poverty and job status and education status and caste system and other socio-ecological factors that affect an individual and that the way they interact with society. Gender can also interact with institutions and systems. These are the economic systems, the legal systems, the business systems, these large structures that are kind of running on their own that automatically include or exclude certain genders in different ways, as well as behaviors. Every culture and society has different gender norms, different roles and expectations, and abilities to influence decision-making, and as well as one's own individual agency. In general, women are also much more likely to be living in poverty. They are less likely to own land and resources that may be assets in a disaster and provide places to go or assets to sell. They're less likely to have control and production of household income, and they may be less likely to have education and training, have institutional support and information or access to information, and less freedom of association to move between different circles and different social groups, and more likely to have fewer positions on decision-making bodies. I think I started this one because this is important to this particular topic of partnerships, and already planting the seed of making sure that there are women decision makers and are women leading some of these discussions and priority setting for how communities might better adapt to climate change, in particular the specific vulnerabilities of women and girls. There is a disproportionate impact of disaster on women and girls. Neumeier and Plumper in 2007 wrote an article that covered about 20 years of disaster, 21 years of disasters, and they looked at the life expectancy rates, they looked at death rates, total number of people that were impacted, and they found that natural disasters result in more deaths of women than men. And it essentially shortens women's life expectancy. And this is further exacerbated by those having low economic status, low socioeconomic status. So A greater number of women that were low SES ended up dying. But this effect can be cut short by having a high SES, then it becomes almost equivalent to males. And so also the stronger the disaster, the stronger the effect. So as these climatic events are making disasters worse and worse, we are going to be seeing more and more disproportionate deaths. And so this means that the social construction of gender, not necessarily the disaster itself, can be responsible for these excess deaths. In general, women hold a lot more responsibility in the household for preparing for and responding to disasters, for getting organized, for getting go kits, for organizing and taking care of children and their needs. And so climate change will continue to exacerbate some of these underlying vulnerabilities that have been set by the social construction of gender. And many climate change impacts are they themselves gendered, but the policies that address them are not necessarily gender sensitive and are not addressing those vulnerabilities that are different for males and females. There are a variety of different ecological threats. I just pulled a few of these from the Ecological Threat Registry and just wanted to highlight some of the potential health impacts and how those gender inequities might play out as a result of them. So for example, food insecurity, we know the health impacts of food insecurity are going to be poor nutrition, conflict due to access to food, as well as household stress that may occur. And so women are more likely to give up their food share or nutritional access for their children or other family members, and that puts them at a disadvantage. During wildfires, which we are seeing more and more of, there's more displacement and exposure to poor air quality. Females are responsible for those household preparations and evacuations. In some of our research, we found that female-headed households were more likely to evacuate than non. And that was after Hurricane Katrina and Hurricane Gustav. During cyclones and hurricanes, there's potential exposure to debris, to damage and loss of the home, exposure to mold in the home, depending on the type of construction materials that are used in the home. But in our research at NCDP, we found that there is an increased risk for mental health impacts of female-headed households. They're much more likely to say that they are experiencing mental health distress after disaster. And there is also an increased potential for mental health effects on children, which has a cascading effect up into the parental units and caregivers of those children. And of course, with the rising temperatures, we are going to see these extreme heat events, stress on power infrastructure, spread of zoonotic disease, water-related and others, as well as respiratory illness. And so all of these events can also increase the caretaking burden that is on women and girls in the household. And it's not just women, it's sometimes siblings of sick family members, which we certainly saw during the Ebola crisis in Sierra Leone. So I have a handful of recommendations and kind of ideas to chew on here to address some of these issues. And so first is exploring participatory research and design methods, working directly with community members to define research questions, to define objectives, and to conduct gender analyses to make sure that as policies are being written, that as strategies are being made, plans are being written, that they are gender sensitive to the context in which they are being implemented. To create local opportunities for improved community-wide disaster planning and climate change mitigation activities and adaptation activities. And that requires new partnerships built upon solid relationships. Partnerships require relationships. They require you knowing who to call when you need help. They require having a coffee and getting to know people and building a connection so that when you really need help, they can be there, as well as more formal partnerships that I think this message is certainly related to. For monitoring and surveilling some of these issues, don't rely solely on large-scale data. There's a lot of different issues in there that probably require a totally new session, but certainly utilizing some ethnographic techniques to make sure that we're getting a more nuanced and deeper understanding of some of these gender-related impacts of climate change and disasters, and talking to people directly that are being affected and the organizations that work with them directly to make sure that some policies and data monitoring activities are actually representative of everybody as best as they can be. to question the accountability to ensure that gender and the role of gender is incorporated into new and existing partnerships and the development of new policies. I think UN Women had done an analysis of SDG 17 and found that there were not enough mentions of gender within any of the partnerships that were being mentioned. Climate literacy, I think we're getting very good about talking about climate literacy and what climate change is and sea level rise and increasing temperatures. But we can't just focus on those data. We need to also get better about communication and understanding how climate change affects the social structures within communities. And so how those gender roles, how those power dynamics and decision-making powers affects people's daily lives and health and well-being. We need to also foster community-based risk reduction strategies, also understanding those gender norms, social systems, and vulnerabilities, and ensure that these mitigation and adaptation strategies factor in their effect on child marriage. There is some evidence that these climatic events are forcing a hand in child marriage and increasing the rates in some communities. And we need to, this was an issue that came up through our work with the Resilient Children, Resilient Communities Initiative, where we began to hear a lot of information coming out from our communities that there was an undercurrent of intimate partner violence that they were not seeing. And in fact, the data showed that there was a decrease in intimate partner violence, and that was only because people were afraid to reach out for assistance, or due to lockdowns were unable to access and get the help that they needed to get. And so there is going to be a potential long-term issue for women and girls as they deal with some of the trauma that they've been experiencing during the pandemic. And to continue to build mental health and psychosocial response structures and systems that are gender sensitive as well. And then finally, including women and girls as change agents in these mitigation and adaptation strategies and decision making. And some of these best solutions are best derived by the people that are most affected. And so with that, thank you.